When someone has a stroke, one of the first things you realize pretty quickly is how much we take communication for granted. Being able to ask a question, tell a story, make a joke, even just say what you're thinking in the moment. After my dad's stroke, that became one of the biggest challenges we were dealing with, and we quickly learned how important speech therapy was going to be. One of the first people helping my dad throughout that was Susan Hakimi. She was actually my dad's very first speech therapist when he was doing inpatient rehab at Northridge Hospital right after the stroke. Those early days are confusing and frustrating, and she was there working with him as he started trying to get the words out again and rebuilding that connection. Dad, when you hear Susan's name now, what do you think about? What do you remember from those first sessions?
It was hard. It was really, really hard working with her.
Yeah, I remember those sessions. A lot of repetition, a lot of things trying over and over again.
It was over and over and over, but it works.
And Susan didn't just work with my dad. She's the head speech pathologist at Northridge Hospital, and she spent years helping stroke survivors and families navigate aphasia and all communication challenges that come with recovery. Susan, thank you so much for joining us today.
Welcome.
Oh,
Course.
well, happy to
Yeah.
have you.
Yes. When my dad first had his stroke and was in the hospital doing inpatient therapy, you were one of the first speech therapists working with him during those early days. You're also the head speech pathologist at Northridge Hospital, and you spent years helping stroke survivors work through aphasia and learn how to communicate after a stroke. A lot of people don't realize how important speech therapy is in those first stages of recovery. So we're really looking forward to talking with you about what that process looks like, what patients and families experience early on, and some of the things people may not understand about aphasia and stroke recovery. So, to start this off, can you tell us a little bit about how you first got into speech pathology and what led you to working with stroke patients?
I wanted to work with kids in the beginning, and my aunt is a speech pathologist or was in the LA Unified School District, and I went to observe her to see if that was something I'd want to get into. And I also was a student aide for third grade and sixth grade, and then I decided I'm not working with kids.
Yeah. Tried
And
it.
I took a class in college that was on the neuro and the neurology and physiology, and that just changed my whole, my whole course of therapy. So I got into it because of my aunt, but I ended up liking the medical aspect of it. So
So, was stroke recovery always something that you wanted to specialize in once you started learning about speech pathology?
it's yes, in the beginning I did, and then it spread out to different things. Brain injury. I like cancer patients, and I do other neurological problems like Parkinson's and multiple sclerosis. So yeah.
For people who don't know, what exactly does a speech pathologist do in a hospital setting?
Okay, we do a lot. When we get a referral from a doctor, we do specialize in swallowing problems. So we do see patients and make sure that they're safe for eating and drinking. And if they're not, we do an X-ray of the swallowing, which is called a modified barium swallow study. We also evaluate them, their language, their speech, and their cognitive skills.
Mhm.
Oh, okay.
So,
I never knew that.
yeah. Yeah. So, when someone has a stroke, what are the most common communication issues that you see?
Probably the difficulty of speaking, the aphasia, and there's another a condition called apraxia, and then dysarthria. So it's usually how it affects their expressive language skills.
Gotcha. So, can you
Uh-huh.
explain in simpler terms for someone who maybe isn't too familiar with aphasia or apraxia what exactly it is?
Aphasia is a language problem from damage to the left side of the brain, and it can be from strokes, head injury, brain tumors, but it's anytime it interferes or impacts your language skills, which means reading, writing, listening, and talking. And apraxia is what they call a motor speech disorder. It means that you can't form some of the words and the sounds. You can't sequence everything. So you sound like you are stuttering. And so a lot of people with aphasia have this too, the apraxia.
Now, do you have when it goes on the left side or the right side? Because on the left side, it's words
Yes.
but on the left side, isn't it more numbers?
Left side can have numbers. The right side of your brain is responsible for the problem solving attention, sequencing, memory. A lot of attention to detail, which involves math. Math
Interesting,
involves a lot of attention.
because that's what we were just discussing, how he doesn't have as much or really any difficulty with numbers as opposed to
Mhm.
how he does have difficulty with reading and speaking and writing.
Yeah.
Right, and some people, like, in your dad's case, because I remember where the stroke was,
Uh-huh.
it was the reading if and sometimes in that area, it's also recognizing numbers, but it's mostly reading and recognizing.
Yeah, because that was
Otherwise, yeah, the right side of your brain's a lot different. It depends. On left-handed people, sometimes their brain can be switched for language,
Yeah.
and that is called cross dominance.
Oh,
oh,
So, for the most part, for majority of right-handers, our language is in the left side of our brain.
okay.
oh, okay.
Mhm.
So, why do strokes affect speech and language the way that they do?
Because of where it is in the brain on the
Mhm.
left side. So it depends where if it is it in the front of the brain, the side of the brain, or the back of the brain. It's going to affect different things. Your language, your comprehension of questions and directions. Reading is usually a little bit further back, like your dad's. And the front of the brain controls certain parts. And the very back of the brain is more of the reading um, and vision.
Oh, okay. Yeah,
Mhm.
because the vision, my
You
vision
can
never.
see.
Yeah,
Yeah.
I can see you. Yeah, no, the vision never really affected me much. It was really the
Mhm.
reading and talking
Mhm.
is
Mhm.
yeah, is how it affected me.
Yep.
Yes.
Uh,
So everybody's different. It depends where the stroke is on the brain, in the left side of the brain, how big it is. Is it one stroke versus many strokes?
So, when you first meet a patient in the hospital after a stroke, what exactly are you evaluating?
Probably the first thing would be the swallowing to make sure they're safe. The
Uh-huh.
second, the probably the most important is their comprehension. Can they follow directions, understand questions? And then I look at how can they are they able to express themselves? And if they are, how clearly is everything clear? Are the words coming out? So I want to make sure. But a lot of times that's what helps me to determine what kind of aphasia they have too,
okay, yeah,
Mhm.
because
whatever they're saying.
yeah, because I
Hmm.
remember, yeah, I couldn't understand, colors and things like that, in the beginning. Uh,
That's the
I
back of your brain again, where the reading is. It's where yours is a comprehension of shapes, numbers, symbols. It could be that, yeah, and
Yeah.
objects too.
Yeah, because
Yeah.
that's what I remember. I mean, right at
Hmm.
the beginning, I remember I couldn't understand,
Shapes or
shapes and things like that because
Yeah.
that's what
Yeah.
you guys were giving me in the beginning were shapes
Hmm.
and like that. So, yeah, and,
Hmm.
that I remember. Yeah.
Mhm. Yeah. So, how quickly do speech therapists typically get involved after a stroke happens?
Well, hopefully within 2 days after
Mhm.
they're admitted to the hospital. I do work with people inpatient, but as an outpatient, sometimes I get them months and years after.
As far as connecting with the patient, do you feel there's like a different connection with them as opposed to if you're starting with them from the beginning or if you're getting them later on throughout their recovery?
It's probably a little different, like with your dad, I met him when he was on the rehab unit, and then he came to me in outpatient. So that we had a relationship already meeting him, and I was familiar.
Mhm.
Sometimes we get people, I just go in and help someone, and it's like,
Yeah.
oh,
Yeah,
you
just
just
going
never
in,
know.
but on a blank
Yeah.
slate, kinda. Yeah.
Yeah. But I put everything I have into it and
Mhm.
try to help the person.
Yeah.
Yeah.
So in those first few days when someone has a stroke and you're, working with them, what's the
Mhm.
biggest challenge you think for the patients?
Accepting some of the changes, the frustration, um, fatigue, and sometimes the family in there not understanding that they're trying their best
Yeah.
to communicate. And sometimes it's hard when you see sometimes families can be in denial. Sometimes patients can. And so you're dealing with the frustration and the lack of acceptance.
And what advice do you usually give to families early on?
Patience,
Yeah.
patience. Try to explain to them what's going on and give them as much information as I can about what to expect from a stroke, too, in general, and also with the communication.
It's not gonna happen quickly. That's what you really have.
No,
Yeah.
Yeah.
it's going to be gradual over time. Some people expect that, and that's where the frustration comes in.
Yeah. That's how yeah, I mean,
Hmm.
I had no idea what it was right in the beginning.
Yeah, none of us
Yeah.
did.
And
Mhm.
so, yeah,
Mhm.
and when I started to be able to read, to walk, to, speak again, it was like,
Mhm.
I'm ready to speak, but it didn't it's now 9 years later, and I'm
Mhm.
still learning, and
Still
uh, I'm
improving.
still improving. Yeah, so
Mhm. Yeah.
yeah, you have to understand, people have to understand that, it's not it that it you're gonna get better, but you don't know how long, you don't know how long it's gonna take, or how better you're gonna get, but
You don't know.
yeah,
Yeah, you don't know.
you just have to keep going, you can't quit, you gotta keep
No.
straight ahead.
Yeah, and you can't compare your recovery to someone else's recovery because everybody.
No, because everybody's so different.
Yeah.
Everybody's different.
Mhm.
Yeah.
So
Mhm.
what are some things that family members should do to help someone with aphasia communicate?
I think allowing them time to express themselves, to be patient, not to talk for them,
Mhm. Yeah.
and to know that not to talk to them like a child,
Right.
and include them in the conversation, even though you think they can't understand, they can.
Yeah.
And I think a lot of people talk about the person, about them in front of them instead of with them.
Right.
Mhm. Yeah, I
Hmm.
definitely think those are some common mistakes that families make without real.
Hmm. Yeah.
Uh-huh. Yeah, so now let's, go back to when you first met this guy, my dad, Rod.
I remember the room he was in. Yes.
Oh god.
Room 25.
Wow. Don't
Yeah,
we all?
yeah. I was helping out on the rehab unit and he could not talk. He
Uh-uh.
was struggling to get a word out and, trying to get to be patient, because he's from the East Coast and he wants to talk.
Yeah.
Yeah,
Right.
exactly.
And in the frustration of that, but just trying to keep you relaxed and to calm yourself, just to know that's okay. If you
Yeah.
can't get the word, that's okay. So, and that was, yeah, the first time I met you.
Yeah.
Yeah.
So
Mhm.
your initial, impression of him was that he was ready to go pretty much. He was
Yes.
there and he
Yeah.
was.
Yeah. He was ready to go.
S
Yeah.
so from your perspective, what stood out most about his early recovery?
His motivation, wanting to get better,
Uh-huh.
and that helps out a lot. I think it was his motivation, and I think also his humor. I think he used a lot of humor,
Uh-huh.
yeah, a lot of that, and that's needed.
Oh, yeah,
Yeah.
I remember some of those some of those days where, I had all these different things that I had to do that day, and they gave me
Hmm.
I thought I was back in school or something, but
Uh-huh.
I had
Yeah.
this a 10 o'clock class and an 11, and so I mean,
Yeah.
and different,
Yeah.
different things that I had to do. But I do remember that, that you gave me, l colors and things. That was that to me was the strangest thing to me, that I saw the colors, but I didn't know what the colors are.
You just couldn't
I
say what
couldn't
the.
And that
yeah,
yeah, and you couldn't say a lot of I remember that's probably what the other therapists were giving you because I remember what we worked on
yeah.
specifically, but, yeah, a lot of it's hard to explain to people that part of the brain, it's the recognition of objects and letters and different colors and, yeah, a lot of things, numbers, and
Mhm.
who people are sometimes.
Yeah,
Yeah, yeah.
definitely. Uh-huh. So what are
Mhm.
some small milestones that are actually huge in the early stages of an aphasia recovery?
I think when people get to the next step, I get harder. I can see that, and so um, it's good to see the improvement. And as they improve, I get harder.
Yeah.
And so then I try to explain to people, it's a gradual, and I go to the next level. And it may not be a lot for the person at the time, but it's like that's why I keep a folder with all those, papers to show people this is where you came from. Look at now what you're doing.
Oh, I have those.
Yeah,
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 I tell you.
I
yeah.
can show you those.
Yeah,
And
he
so I think that's really helpful is to show people what they were doing in the beginning. And
oh,
then I hold on to all that throughout our therapy to show them, look at this. Look where you were at when you started.
I know, I'm telling you, I look at these, and it looked like I was like, I was writing like I was in kindergarten or in 1st grade.
Yeah,
So
yeah,
yes,
yeah.
I mean,
Uh-huh.
that just, like, blew me away, that I can't believe that that's what I was doing the first couple of weeks.
But I
So
think that's helpful for you to see because a lot of people think they're not getting better. It's not fast enough and they don't see the progress.
Uh-huh. So, yeah,
So,
it's important to have those papers, I agree.
yes, I keep them. I keep a lot. Yeah.
So, do you remember a moment specifically with my dad, where you saw progress that gave you, like, real hope?
I think it was more in conversations when we would talk about things and he would share some life experiences, his ability to talk about it.
Yeah.
Uh-huh.
And that was good. Yeah.
Totally, yeah.
Yeah.
Yeah,
Yeah.
you gave me things that I had to, like, write a 2 letter a 2, sentences,
Oh, yeah.
about something, yeah, 2 or 3
Mhm.
sentences. So, yeah, I mean, that had me started, that got me to start writing a little bit of,
Yeah,
yeah,
writing's one of the hardest, it's
and
one of the
still
hardest things to
yeah,
do.
it still is to me.
Mhm,
I mean, writing
Mhm.
to me is still really hard. I
Mhm.
write, and then I look at it, and I say, "Well, that word is a P, and that word should be that,"
The
and,
P and the D's and the
I
G's and the I know what they were.
yeah,
I know what they are.
I
P's and D's and Q's and yes.
yeah,
yeah, I
Uh-huh.
mean,
uh-huh,
so,
Yeah.
and to, now, even when I'm writing something, I'll write it up, and then I'll look at it, and I'll see that
Mhm.
my P was a D, and my P, so
Mhm.
even
Yeah.
writing, involves it in
but,
that.
like, if you write the word "and" where it's A-N-D, you might write
A&P,
A-N-P and
yeah,
not even realize
Right.
it.
yeah,
Right.
and so
Yeah,
I'm
and he knows, and then he looks at it to recognize, "Oh, wait, something looks funny." And your
Yeah,
R's too,
yeah,
but, yeah, so, I've met other people have the same exact letters and have problems with that, so it's the specific area of the brain
yeah,
that is responsible for those. It's amazing, yeah. The
yeah.
brain is so complicated.
mhm.
Yeah. Yeah.
So, people often expect recovery to be quick. Why is stroke recovery more of a marathon than a sprint?
I think because the brain is healing, and you've heard about neuroplasticity too, the brain is trying to rewire.
Yeah,
Depends what type of stroke too. Again, it takes time for the healing process. And sometimes all of a sudden you see a change in a week. And then it's like, wow, and that's where you see physically, and with their language too, you can see the changes. And it's like the brain is starting to heal a little faster, but it does slow down later on.
Yeah, that's what people think. That people say that that you only have it takes it only lasts like 10 months or a month. I mean, a year
They
or
used to say a year. Yeah.
yeah,
yeah,
yeah. But
Hmm.
to me, I believe that means nothing because you're always going to get better.
exactly.
Yeah.
It takes a long, long time. The first couple of months, yeah, it goes quick,
Hmm.
and then it gets slower and slower. Less, not as quick as the days go
Hmm.
on.
Mhm.
Yeah. As the years go, and then you're having, normal aging process too. So,
Yeah,
Right, yeah,
yeah.
you have to
Yeah.
remember that.
As you get older.
yeah.
Yes.
I don't
Yeah.
want to believe that one.
Right behind you, Roger.
I
Yeah.
so what determines how much someone might recover, in their speech and language?
I think a lot of times the age, the younger you are,
Yeah,
the better outcome. Depends how big the stroke was, where it was, how much damage it did. It depends a lot on the person's motivation too.
yeah,
Okay, the person has to want to do it, and then having good family support
yeah,
And
or
that's yeah.
caregiver support.
That's what
mhm,
we
Uh,
always talk about. We always
yeah,
say that, yeah,
mhm.
I feel really bad I feel really, really bad for somebody that they don't have,
They don't
uh,
have anybody.
yeah,
yeah,
Yeah.
yeah,
uh-huh,
Yeah.
yeah, no,
Mhm.
it gets me really sad,
mm,
when that
Yeah, and I meet a lot of people like that, and it's really hard, but, and then, that's why your therapists are like your cheerleaders. We're there because a
yeah,
lot of times we know people don't have anybody at home, and it's hard to motivate.
uh-huh,
But I think that really is a big factor in
yeah,
that, and the person, the wanting to communicate.
right.
mhm, yeah,
Mhm.
yeah, no, I definitely think, our family being there for you, I mean, we never, left the hospital, we were always there for this guy.
Mhm.
We did everything we could for him in
Yeah.
his
Yeah,
recovery.
Bonnie always came in. I mean, she was there, you
She
know.
went to all my classes, yeah, in the
Yeah.
first yeah, I'd say the first 6 months, I mean, she was at every one of my classes, yeah.
Mhm. And then little by little, just gradually, yeah, she faded out. So, yeah.
Yeah.
Well, because you were doing more on your own, she
Well,
wanted
yeah,
you to
Exactly.
be more independent.
And yeah.
absolutely. No,
Mhm,
Uh-huh.
absolutely.
Yeah, as it should be.
Yeah.
Yeah. Uh-huh.
mhm.
Um, so, uh, so this obviously is very emotional work for you. So how do you handle some of the tough cases?
Sometimes, I do cry. Um, I pray.
Yeah.
Um, and it's hard. It's hard.
Yeah,
Mhm.
well,
Yeah,
you're
yeah,
working with so many different types of people and
yeah,
different types of
And
strokes.
I want to help, and so I do my best. But
yeah,
there's some times where no matter what I do, the brain is just not cooperating.
yeah,
So I get very frustrated also, like the
Yeah.
person, but I do try my best.
yeah.
Oh,
Yeah.
of course.
And so while doing your best, what really keeps you motivated after all these years?
To see the progress
Yeah.
and developing relationships with the
Mm,
patient and family.
yeah.
Um, I think that's the biggest part of it
Yeah. No,
is
I got
developing the relationships too.
Yeah. Yeah, no, I have to imagine it's gotta be what an amazing experience to see my dad now, 9 years later.
Mhm.
That's got
Mhm.
you
Yeah.
I
Yeah.
mean, to
'Cause I
know how
remember. I
yeah,
remember.
to know how grateful my whole entire family is and everybody in
Mhm.
our life from friends that we
Thank you.
we all saw him back then, and we're all so thankful for you, 'cause without
Yeah,
you
thank you. And
yeah.
I mean, he's had help, by other speech pathologists. I think you're continuing to
Oh,
work with
yeah.
Yeah,
some.
yeah, yeah.
Yeah.
I
Yeah.
continue right. Yeah, I go once a
Mhm.
week. Oh, yeah.
Mhm, but yeah, I just mean you at the beginning, so you started him off.
Mhm. I gave him all the homework. Right?
Original homework.
He
Yep.
still gets homework, he's still complaining
Oh,
about
you do? Okay.
Yeah, so yeah, I get anywhere from 8 to 10 pages, a question, not question, but different
Oh,
things.
the reading? Mhm.
Well,
word.
it's reading, it's word searching.
Mhm.
All
Mhm.
yeah, I mean, it's all different things I get, but I get, like, usually, I'd say 7 to 10 pages every week that I'm supposed to do.
Oh,
So
okay. Good. Good.
Going strong. Um, so are there moments with patients that really stick out to you? Maybe not something with my dad, but is there something else that sticks out to you?
Yeah, I mean, I like it when they share some of their life stories and they tell me about their, how they met their husband or their wife or their, what they did as children. They talk about that and brothers and sisters. I like hearing that
Yeah,
and sharing those. Yeah.
definitely.
yeah.
hmm
So so what do you wish that more people understood about stroke and aphasia?
It's what I've seen sometimes it's not the person's fault, okay, that has it. They're not doing it on purpose.
Yes.
Because I do see that. I think to let them know it's part of the brain. They're trying their hardest to get words out, and everything's in there. They just need time
Yes.
and people to be patient, right?
Yeah, it's the most frustrating thing because I try
Mhm.
come up with the right word, or I'm having a conversation.
Mhm.
I say, like 3 or 4 sentences, and then all of a sudden it comes to the next one, and yeah, and I just can't come up with the right word. And what
Yeah.
happens to me is I freeze. I totally freeze.
Yes. A lot of people do.
Yeah,
Mhm.
I mean,
Yeah.
another one is we're going out to a restaurant and getting and having to order something.
Mhm.
So my son will order, my daughter will order, mommy will, my wife will order something. Then it'll come to
Mhm.
my turn, and I'll like,
And
I
you had
have,
it prepped in your head.
yeah,
You
yeah, I know what I want, and
Yeah, and a lot of times it's like, okay, take a deep breath, stop, just think about it. You can do it. So it's a
yeah.
constant like that,
Yeah,
uh, verbally telling you, you can do it. You can do it.
yeah,
Try it.
and he'll tell us, "Don't tell me, don't talk for me, I need
Mhm.
to," and we'll let him take his time and do it.
yeah,
Mhm. And I think the patience, that's a big part of it is being patient, you
Yeah.
know, and
Mhm.
allow the person time. Yeah.
yeah, absolutely.
So, if someone listening has a loved one who just had a stroke, what's the most important thing that you think they should know?
Um, again, give them, be patient, try to allow them time to express themselves, get them help.
Yeah.
Sometimes people don't want it. And it should just, the most important thing is get in there and start therapy as soon as possible.
Yes, exactly. Yeah.
Yeah.
Yeah, I mean, because a lot of people, their insurance ends up quick, and
Well,
they
that's a big problem, is the insurance, the limitations, you wanna continue, but you have restrictions or the limitations, and so always having to worry about the insurance
Yeah.
yeah.
No.
is a big part of it.
Uh-huh.
Mhm.
Yeah, no, that's
Yeah.
scary for a lot of patients.
Oh, yeah. It's hard. It's hard.
Yeah.
But
So,
I would tell them to keep trying, tell them to encourage the person who has aphasia, to encourage them, and they have to be the motivator too,
yeah.
the cheerleader.
Uh-huh. Yeah.
Yeah, like you guys do with your dad.
Yeah.
Yeah.
Yeah, everybody needs someone, so,
Mhm.
yeah.
Mhm.
So, just to close this out, so when you look at someone like my dad and where he is today compared to the hospital, what does that mean to you as a therapist?
I'm proud. I'm hopeful for other people too,
Of course.
that they can get better. I'm proud to you starting this podcast and wanting to educate and train other people because it's not easy.
Mm-mm.
Okay. And I know you like to talk, but it's important that you're sharing too your experiences with other people who feel like there's no hope.
Yeah, you always
And,
you have to keep going forward.
mhm,
You can't stop, and you gotta keep trying and keep,
mhm,
just keep moving is what it amounts to.
mhm.
Just keep
And
moving.
I think in the beginning too, I remember encouraging you and other people to get counseling.
Yeah.
Um, yeah, because we can't do it all. Sometimes you need the professional help to
Uh-huh.
help cope with a lot of the changes and the frustrations.
Oh,
Y
yeah.
yeah,
You
no,
know,
that's something that I've seen from talking to a few of our other guests, that people don't really know the mental health side of having a
it's
stroke. People we're not prepared for that when you're getting speech therapy, occupational therapy, but you're not getting mental health therapy. And so
That's the hard part, yeah,
yeah.
and I do explain that to people, I do as much as I can, but
Mhm.
I'm not a licensed
Of course.
psychologist to do that, so I try to get people encourage them to seek the counseling.
Yeah.
Again, depends on their insurance and how
Yeah.
important it is. Because sometimes, I mean, depression is a big part of it, and sometimes you need a little bit help from medication too,
Yeah,
and the
Mental.
counseling.
the depression is the biggest thing in the beginning, I
Mhm.
yeah,
Yeah.
'cause you didn't know what it was, you don't know what it is, and all of a
Mhm.
sudden you got something that
And your life is turned upside
yeah,
down.
yeah,
Yeah, from that.
And
and
and that's what I do try to explain in a lot of my outpatient sessions. People are not told or don't remember being told or educated by inpatient or the doctors. And so it's my job and the other job of a lot of the outpatient therapists, to identify that because that's usually when depression hits,
Yeah.
is usually weeks and months after you've left the hospital.
well, yeah, because you
Hmm.
think you start to being able to speak or you start so you get
Hmm.
it stops. It kind of like
Hmm.
and then that's when I think the depression comes in.
Yeah, you're in more social, situations, and you're now not able to behave or act as you
Yeah,
would in the past, and you're,
Hmm.
"Wait a second, I've been in therapy, I'm doing this, this, and this, and,
and I still can't
yeah,
do
and
it,
I
yeah.
still can't do it."
Yeah, it kinda hits you then outpatient, I can't drive, I can't go to work, I can't have role changes, and so a lot of people they're it hits them more. I see it more in outpatient.
Mm,
Yeah,
Yeah.
because I mean, they took my driver's license away immediately, and I didn't drive for, like, 2 years. So,
Mhm. Mhm.
until I was able to,
But
so
your independence is taken away from you.
right,
I mean,
absolutely,
that's a big part of it,
yeah,
mhm,
and to be able to address all those problems, you need to see someone to help you through that.
yeah, no, absolutely.
mhm.
Yeah, cool.
Mhm.
Alright, well, thank you,
Yeah.
and this was awesome, thank you
Oh,
for being
you're welcome. You're welcome.
Yeah, no, we really yeah, I'm telling you, you helped me.
Mhm.
You saved me.
yeah,
Oh, thank you, thank you. It was always fun working with your dad,
uh-huh,
and we had, you shared a lot of good stories.
Oh,
yeah.
yeah,
Still.
we had a lot of
Good
fun, a lot
good
of fun.
No,
times.
a lot of fun memories that you shared,
Yeah,
and
it was
that
it
was good.
it was
Yeah,
good. No, again,
yeah,
we really appreciate you like, we really appreciate you having you today. We really do.
yeah, thank you for asking me.
Of
Yes,
course.
yeah.
Yeah,
Alright,
okay,
you take care of yourself and
Okay,
family.
yeah.
Alright,
okay, you too, and then I'll see you soon.
Yeah,
okay,
sounds good.
absolutely.
All
Take
right.
care.